but it was a life changer for her. Her eyes looked more open. She just looked more youthful, and
Mhm,
she was so thankful. And when I hear the words from my patients, this is life changing for me.
mhm.
Like I go home a happy woman and it fulfills my soul.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Connie Brennan, a board-certified nurse practitioner and aesthetic pioneer, who balances cutting-edge science and art with compassionate, holistic, evidence-based patient care over the last 30 years. She is the president and founder of Aesthetic Enhancement Solutions, which is an education-focused company, and partners with leading aesthetic businesses such as Allergan, Galderma, Merz, among many others. Connie also serves as the Aesthetic Educational Director at Lifetime Aesthetic Center. So Connie, welcome and glad to have you here.
Thank you so much for inviting me. I appreciate that. I'm looking forward to it.
Yeah, well, let's just dive right into it. Tell me, how did you first get interested in aesthetics?
That's a great question because I didn't really know I was interested in aesthetic medicine per se. As a young person, I've always been in the arts. I was a wedding singer for years. I was a photographer, had a studio when I was in my teens, and always more entrepreneurial, loved the arts. And then I was recruited after my medical assistant training by a plastic surgery company saying, hey, we'd love to have you take our photos and work in our clinic. And so I thought, why not? That sounds great.
Mhm.
And from then on, it was like I got bit by the bug of aesthetics because I loved it. I loved every minute of it. I love the patient population just wanting to look as good as they feel, and they're healthy people looking for just, a better life. And so I just got bit by the bug, and here I am 35 years later.
Wow. Well, can you discuss some of the popular treatments that your clients come to you for, and also why do you think they're so popular?
Well, I would say that Botox, it is talked about as the gateway drug.
Yeah.
It started out, actually, Botox wasn't even around when I started in aesthetics, so we didn't really know what that was. But since Botox came aboard, I think people have at first very afraid of it. Then it's become kind of that gateway to, I must need Botox if I have a wrinkle. And also I want to prevent wrinkles, which is preventative medicine is now a huge topic, regenerative, preventative medicine. So in my mind, Botox is something that anybody can use probably after their early 20s, because we're all getting wrinkles starting about then. And then also to kind of not only prevent, but then correct. So those of us that have wrinkles already coming in and just saying, how can I make this look a little bit better? And we all kind of want to feel as good as we look and look as good as we feel. So they kind of go hand in hand. So I'd say Botox is really, really popular as far as one of the most popular. And people call Botox all the neuromodulators on the market. So you have, 5 of them now. So no matter which one they get, they come and ask for Botox. So it's kind of like Kleenex and, puffs, and
Yeah.
even the generics get called Kleenex. So, Jeuveau and Dysport and Xeomin and, the newest Daxxify on the market, they're all phenomenal products. And each clinic carries different ones, but I will say that people come in and they want Botox, and they just ask for it many times by name.
Yeah. Okay. Got it. Now, you kind of talked about people looking for that more natural look, holistic regenerative medicine. So are there any new or emerging treatments that you're particularly excited about that are coming out?
Well, since Botox and fillers, so fillers have been around longer than the neurotoxins, neuromodulators. Collagen was the first one on the market in the 80s. That's the one I first started working with, and then kind of grew into the hyaluronic acid, which is more natural because we make it in our skin and organs. And now we're playing and using a lot of PRP, and PRF, which is what we draw from your blood. We get the protein, we get the fibrin from your blood. We can spin them together and make a filler out of them and really fill some things and cause collagen growth right there on the spot and elastin. So that's really exciting to think that we can do that. Sculptra is one that people are on the Sculptra bandwagon these days, trying to regenerate their tissue and make their skin look better. So those are very exciting kind of regenerative tools that we can use in the skin. Radiesse is another one that people talk about. And then of course the little threads, small little threads to kind of regenerate collagen. Some people love the big threads. I'm not a real big thread person at this point. And then surgery has really changed for people. The facelifts that I work with plastic surgeons. So it used to be, you're just going to take a little skin and snip it back and you get the weird kind of rolls. And now it's really, how can we get this to look more natural? And maybe we start a little earlier. I actually could use one of those. Start a little earlier and tug a little bit. So there's just so many things we can do to help patients feel and look their best. And I think regenerative medicine, and I play a lot in that market on the functional medicine side in my clinics now, which I'm really excited about, because internally, if you can get the patient healthier on supplements and IVs, those are becoming big things. We're going to just give you a lot of vitamin C and different immune boosting things that can really help the skin in general. And then of course you've got the whole laser end. We have a whole laser faculty, and that's pretty exciting, because if you can, resurface the skin a little bit at a time, you can help pore size and skin texture. And if you don't have pretty skin, sometimes some of the things we do to you don't look that great anyway.
Yeah. Okay. I got it. Yeah. That's kind of one thing that I've seen a lot of practitioners struggle with, is that they have patients coming in, they think they need something, or they're looking for that Instagram filter look, and it's just, it's not reality. So there's only so much you can do, right?
Yeah. And you asked me a question I think is really powerful, as far as why do patients come in and what do they ask of me? My patients really ask of me to be honest with them. And I think integrity in this business and in field of medicine is so important, because we can only do so much with one product. And sometimes it takes a myriad of things to really achieve a goal. It's like when you build your house, you could put all the struts up, but if you don't put the, all the sidewalls on and the paint and the spackle and all the things, you can't get a house. So when you look at a patient, depending on you're coming in to see me and maybe you're 25 versus 55 versus 75, there's a lot more that goes into kind of regenerating and rejuvenating that face. And sometimes it's more than just one or two things, and maybe it is surgery. But my patients ask for honesty and integrity, and that's where I think is the best platform I stand on, because if I don't think I can help in something, I'm going to send you to somebody who can get to that versus something I would do.
Okay. Now you kind of bring up this point that if you can kind of explain this to someone who doesn't know much about medicine, or is maybe looking for a way to look younger but doesn't know all the available options. And I think that this is very applicable, since you kind of had a background of working in plastic surgery, where a lot of like medical spa practitioners don't. So what would you say is kind of the biggest difference between treatments that medical spas provide and what traditional cosmetic surgery practices provide?
Sometimes I would say med spa. So Lifetime has a med spa, and I work in that's arena. We have a plastic surgeon, actually that's our medical director, but not every med spa does. Some med spas have physicians that aren't even trained in aesthetics. So they really sometimes don't even know some of the tools or how to use them. So that's a little scary. Having a plastic surgeon medical director for us is phenomenal, because when we know our limitations, like we reach the ceiling on that patient and you can't put more filler in and you can't rejuvenate the skin, and they really need a lift or an eyelid or something, we have that automatic referral. We know exactly who to send you to. So the continuum of care is so lovely. In some med spas, they may offer only injectables. I've seen med spas that just offer the Botox fillers, maybe PRP, so anything they can inject under the skin, but they can't follow it up with comprehensive laser treatments or skincare treatments. And then there are other med spas that offer kind of a little dabbling of all, but maybe not a comprehensive palette. Like maybe they only have Xeomin as a neurotoxin, and maybe they only have that same brand's fillers, so they don't offer a palette. So it's really up to the client to kind of do their due diligence on kind of what is it that these providers offer, and also their experience and their training. And that's hard sometimes to tease out when you're making phone calls. How experienced is your provider? How many, you may call and say, oh, how many treatments have they done? And they'll say, oh, well, they've been injecting for 17 years, but maybe they only do 1 day a week. So you kind of have to, really tease out as a client to get knowledgeable information.
Okay. Now that brings up a very interesting point, is that as you talk about, there's all these different options, and even when it comes to combining different options together to get you the best result. So how do you approach educating your clients about your services and the benefits, particularly when it comes down to you need to combine certain things together, or even they come in with their own preconceived notions, oh, I want this, but it's not the right fit. So how do you approach educating them whenever you run into situations like that?
I would say that there's a lot of patients, including myself, where I'll say, I really want to have this put right there, right? And I'm a knowledgeable human being. And sometimes I think it's important for me I sit back and listen to that patient. And while I'm listening to you, I'm actually examining your face in a normal kind of way, like, how are you moving today? And what's happening with your tissue as you move? And is there support in certain areas? And you may say, I really just want this filled right here, which is kind of a common thing, or I just want to do this. And a lot of times I'll ask the patient kind of what's their favorite thing about their face. Because maybe their favorite thing about their face is their smile, and their mouth area is just not kind of up to par in my head. And of course, when you think about that patient's request, we really need to meet the patient where they're at too, because maybe there's lots of things behind that. Maybe somebody said, how come you're crabby today? And they're responding to that. So they really want Botox there. Or maybe their budget is this big and they need just this much. And so you're trying to really navigate that patient's desire, the patient's goals, their budget many times, maybe their psychology, what's happened to them today and who said what to them and what brought them in. So there's a lot of things you're navigating. And I think it's I look at it as a real holistic thing, because I want to find out what the patient's feeling in there, what they're seeing on their face. And then is there some things I can do to help maybe just the area they're asking about, but maybe there's other things I can do in the surrounding area that can also meet the goal. Because maybe the goal isn't really to look younger. Maybe it's just like, I want my skin to look smoother, or I just want to look fresher, or I want my eyes to look more open, or I need my smile to look as wide as it used to, because here's my, they'll bring in pictures sometimes and you're like, yeah, that's a decade ago, and we all change over the course of a decade, to be sure.
Yeah. Okay. Now we're kind of talking about the preconceived notions some people have when they come in. So what would you say are some common misconceptions your patients or your clients come in that they have about the treatments you provide?
I think that when a patient has static lines, and what I mean by static is that means that line is there when you're moving or not moving, like it's always in the skin. And I think that patients' preconceived notion is that if they have a line, Botox or Xeomin or can erase it. I want you to make this line go away. I also think they think that if we put filler in a line, it's going to make it go away. But truly the line is in the skin, and the skin is in the surface layer when it's static. Now, if a line is, we'd call it more an active line or something that is in activity, we can sometimes conquer that with a neurotoxin neuromodulator in the area, because it makes the muscle relax. But in order to erase a line in the skin, it's nearly impossible. You can smooth it out better, you can tighten the skin a little more, you can fill things up, but that line may now be permanently in that skin. So it's one of those things where I think that preconceived notion can be tough, and you really have to be honest with the patient. Like, it's going to take us treatments, it's going to take us this and that. And that's kind of hard sometimes, because patients think, oh, this is magic, we can just make it happen.
Yeah.
Yeah.
Okay. Got it. Now, I want to kind of talk about differentiators, kind of what sets you apart from others in the industry. We talked about you've been in the industry for 35 years. You have a background kind of in the plastic surgery side and also on the medical spa side, also now the functional medicine, the regenerative medicine. So what would you say are some other differentiators that sets you aside from your competitors?
I would say in my space, I've been doing this for a really long time, since pretty much the beginning of aesthetic medicine. So that already is a differentiator. I have a full practice, so I don't really, I don't advertise to new patients. The new patients usually see my trainees, I would say, my nurses and PAs and nurse practitioners that I've trained, doctors that I've trained. So that's a differentiator. Patients have a hard time getting in to see me. They usually have to wait a long time. And sometimes that's okay, because patients understand that they don't want to cancel that appointment, because in this space, sometimes patients think, oh, I can just get in anytime I want to, but it's not really true. And I also set my patients up on a plan. So if you come in today and we talk about, I would love to have this frown line kind of gone if I can and keep it away, then I need to see you 3 times a year at least, minimally. And I want to see you 3 times a year. So let's just go ahead and put that on the calendar, because I'm going to see you this month, and I'm going to see you in April, and I'm going to see you in December. So or August, we'll just put everything on the plan in. And I love doing that comprehensive kind of evaluation and planning for you, because then you can budget your year, you know what to expect, you're not surprised or sticker shocked by it. And then you can choose if you want to cancel those appointments. I'll say, let's put them as a placeholder because they're there. You can always cancel or move them, but at least you have your spot in our world together. And then we get to make this a long-term relationship versus just a one-night stand. We don't want to have it be like, you get your Botox today and then you go see another practitioner. Because to be really honest, if you see 3 different practitioners, you're going to have 3 different results probably this year. And then also is, as a practitioner works with you, they start to learn your face. And the beauty of that is that hopefully as you age, we age together. I can watch over your face, and when I start noticing changes, we can actually get at them. And so it's been kind of a wonderful journey, because I've had patients that have been with me for over 30 years.
Oh, wow.
And I've watched them age from their 50s to their 80s.
Uh-huh.
And, I had a patient at 82 that got married a couple of years ago.
Wow.
And she still looks like she's 60. And
Uh-huh.
you know what? She looks amazing. And I've had her for 30 plus years. And it's just awesome.
Yeah. Oh, that's amazing. Now, for this next question, I'm actually really curious how you're going to answer this, particularly since you've had a little bit of a artistic background. But when it comes to medicine, people always think, oh, you have this step-by-step process. It's very systematic. So what would you say, what role does creativity play in how you approach your client care?
I would say without creativity, you won't be a good practitioner in aesthetics. There is a step-by-step process that the companies will teach to manage the FDA clinical trials.
Mhm.
So when they had the Dysport clinical trial, they used 10 units in each injection point in the certain muscles, and they got really good results for all the patients in clinical trials. So that's all published. Same thing with Botox, Jeuveau. They all had to have kind of a systematic approach. The creativity part of that is really understanding the depth of the muscle in that particular patient, the thinness or thickness of their skin, their pattern of movement, their proportion in their, let's say, forehead to third proportion to their nose to their chin, what shape of the face they have, how breadth are the temporal fossa. There's so many little pieces to it that as you study sculpting. So I have a skull in my office and I show patients. I have a flip chart that has kind of tissue layers. Like I show them, this is what you've got, but here's your fossa compared to this picture. The pictures, you could study them all day long, and every patient is so unique.
Yeah.
So you're always looking for those intricate things on that face to say, oh, that brow is a little higher there. Maybe we should adjust that with our toxin, or that nasolabial fold on that side's a little deeper. Maybe we'll add a little more of our filler there than this side. So you're always kind of customizing it like a fine seamstress would customize for that frame. So that's really a creative part. And that actually makes what we do the most interesting and the most exciting. Because to be honest with you, if I had to just put a staple gun in the head in the same place all day long, I don't know if I could do what I do. And I think that most aesthetic providers would agree with that, because art is so much of our passion.
Got it. Now, I'm sure throughout your entire career, you've run into some particularly challenging cases. What's maybe one case that really stands out where it was a really tough case, but in the end, you were able to get them a successful outcome? There's
so many and so much fun, because I get to really help a lot of my colleagues. But one that was kind of recent that stands out in my head was, she was a little into her 60s, and she came into actually one of my apprentices for actually some training on cheek filler. I think it was cheek filler. And my apprentice came and got me. She goes, Connie, you need to look at this patient's eyes. It's just so interesting. And I love hearing the word interesting. I'm like, okay, let's look. So I came into the room, and this woman is beautiful, but under her eyes, she had this puffiness under her eyes that it looked awful. And I said, tell me, when's the last time you had filler underneath your eyes? She goes, oh, Connie, she goes, it's been 7+ years. She said, this isn't filler. She said, my doctor told me that this is sinus stuff, and I just have to live with it. And I said, oh, sinus stuff. I said, that's not sinus stuff. I said, that's filler underneath your eyes. It's basically surfaced, and you have got a pool of filler. And it looked like she had been crying for days.
Wow.
And here she had lived with this for years. And she said, well, I'm really, she goes, I don't know what to do about it. And I'm like, I know what to do about it. I said, let's take it down slowly. So we used it's called Hylenex, which is a hyaluronidase, which is an enzyme that breaks down filler. And if you do it gradually under the eyes, you can slowly break it down without making the skin too loose. If you do it fast, all of a sudden you get this really loose skin that doesn't have time to retract, and she's older. So we're already worried about loose skin. So I warned her, you may need a lower lid blepharoplasty when we're done with this. But if I take this down slowly, let's see how this goes. And let's see if it's responding to it, because if it doesn't respond to it, then it's sinus. If it does respond, then we know that it's actually old filler that has kind of migrated into place or been pushed into place. So we started our process. I think we did 3 treatments, 72 hours apart, slowly. And she came in at the end and she said, this is life-changing. I actually have her picture if you want me to show it to you. She goes, this is life-changing for me. She was just in tears. She's been a loyal patient ever since. My apprentice and I, who is now an active injector PA, we see her often. We've seen her for various things. but it was a life changer for her. Her eyes looked more open. She just looked more youthful, and she was so thankful. And when I hear the words from my patients, this is life changing for me. Like, I go home a happy woman, and it fulfills my soul. So that was a really great case, and that was just recently.
Okay. Yeah, I think that's one thing that a lot of people don't really appreciate about the aesthetic industry is a lot of people from the outside looking in is like, oh, it's just about vanity, it's just about looks. But whenever I ask this question to providers, like, what's your most, like your best success story? It's always about situations where it was life-changing. It really just turned their life around. They were either dealing with something that just everyone told them it couldn't be done, you have to live with this, or just something that was just an emotional drain on them. And once they get it fixed, it was just, they're a different person afterwards.
Well, I would say that this specialty, there is nothing better than boosting people's confidence. And, there's lots of sayings out there about confidence, like it's the best asset you can wear, it's the best accessory you can wear. Like, confidence is something where when you can have that as a human, you function differently in your world. You can get on stage. I can get on this podcast. This is very nerve-wracking, but confidence, if you look as good as you can and you feel good about how you look, many times it can boost. You can get up on that stage. Maybe you can be a better mom, a better anything, because you feel good about yourself. So there's a lot about what we do that's really psychological, as much as touching the patient and being involved in their journey long term. And it is life-changing for so many patients. And you're right, not a lot of people see this because they see it as vanity. And I don't know, just there's a lot of judgy people out there, and my patients will come in not wanting to tell their spouse or their significant other or their kids or whomever. But I think judgment's tough in a lot of spaces, but this is a very judged space for people.
Yeah, I mean, that's a fantastic story that you shared, and just kind of how you're able to help people and turn their lives around. Now, I want to switch tracks a little bit. I want to talk about your education company. So you have an education company. So tell me a little bit about your education company, like a 30,000 review, kind of what you do, who you do it for, what kind of courses, like what kind of training do you provide?
So there's more to come on this story, but currently I started my aesthetic training company in 2009. And back then there was just a real need for more training because there wasn't a lot out there. I came to this industry and field of medicine with really no training, and it was a lot of mistakes made, and that's how we learned our lessons. But now there's so many great instructors out there. I've been instrumental in teaching many of them to become better. They've taught me over the years to become better. And I really wanted to try to fill some voids and some needs. One of the things that I really wanted to fulfill was, back in the collagen days, we had a small little tray that the collagen came in, and the little syringes were lined up, and we put the tray in the refrigerator. And I love those little trays because they were so handy for me, because you go into a clinic and there's things all over the place. There's a drape and a Mayo stand, and there's stuff like falling over. So it took me about 20 years to develop this tray, and 4 trials with it in my clinic and many prototypes, and finally I created this tray. So that was one of the things I really wanted to do, with a lid on it so it was safe, that it could be autoclaved for clear safety and cleanliness. So that was one of my passion projects. And my other passion projects were some flip charts anatomically so that we could teach our patients better. So I made an anatomical flip chart that's a real big one that you can sit in your room, and providers can use it with a dry erase, and they can flip through different pages so patients have a visual of, like, what layer are we going into, and let me teach you about the fat underneath your skin, and let me teach you about your muscles. And so that was a passion project for me. And then I developed some posters for trainings, because as instructors, it's hard sometimes, these books, you can't haul around a whole bunch of books to try to teach anatomy. So I wanted to try to put them together with muscles and fat of the face and layers. And so that was another passion project. So that's all part of that company. Those things are online. You can order them if anybody's interested in them. And then the other thing is, I was being asked to teach by a lot of different people, both privately and publicly. And so I wanted to really connect with the companies that I believe in their products, and they connected with me. And so I contract through my company to teach for them so that I can give quality education for all the products that I use. And I use many companies' products. So I feel like it's really a good idea for providers to use all products as much as they can to really understand the rheology of everything and kind of how things work. And so I really make it a point to try everything. And of course, we all start to get our favorites, but I felt it really a level of in my heart and soul that I needed to always give back. So I go to many conferences, I pay for them myself, and I go and learn. And then I take everything I learn in hopes of being a conduit so that any of my students can get any information I may have in my head. And that's really kind of why I started it. It was just kind of a passion project back then.
Got it. Now, what would you say is the best person to come to your training? Because you talked about when you got started, you really had to do it by trial and error.
Yeah.
So what kind of person would you say is the best fit for your training?
There's a lot of rungs to go through. So I have an apprentice program right now, which is a brand new person, never having had an experience. I have one per year. It's a year-long program. They come and work for us. Basically, the intention is that we'll take them on with our lifetime group as one of our providers. And then we have a mentoring program. So that's a brand newbie. I teach for all the companies, and I teach beginning, intermediate, and advanced. And advanced for me is so much fun because it's challenging, and there's, people that come in this industry and they think they know a lot, and then they get into a course and they're like, wow, I didn't know that. And I'm like, I didn't know that either until just a few years ago, because it's ever evolving and changing. So that's that part of it. And then I have an independent program where people can come and shadow. Let's say you were a provider for like the last 2 years and you were just kind of stuck. And you could come into my practice and just kind of watch a day and how it flows. So that's a whole nother thing. And then I can customize it to you. And then also I do more private trainings. I would say less private trainings than ever because I'm so busy with the other kind of structural trainings. But if there was a person that was just really, really kind of stuck and wanting to get an individual program, we may take a while to get there, but I can also do that. So there's just a lot we can do. And I love all aspects because it keeps me very involved.
Got it. Okay, that's fantastic. I mean, it sounds like you're busy enough with your current patients and then also training people as well. So
Yeah.
now I'm curious, where do you think the future of aesthetics is going? I mean, you kind of seen it from the beginning when most products that people are using now haven't even been out. So where do you think it's going?
I feel like we, as a specialty, have been driving with one foot on the gas and one foot on the brake for about the first 20 years because we didn't have a lot of new products that came to market from the 80s to early 2000s. All of a sudden, the early 2000s hit and that gas pedal starts to take over. And I feel like now we're kind of on speed warp. Like there's more than ever companies that are coming out with even like, let's pluck a hair follicle and let's save your DNA in a bank that maybe we can use someday for regeneration. So there's so much happening in the aesthetic industry. I feel like we're kind of like, we almost need a little bit of a break so that there's so much to learn that aesthetic providers coming in almost are overwhelmed because there's so many things to learn at once. So you almost have to kind of like you said, almost put a little grid on and say, okay, let's learn this first. Then we have to learn this, because if you learn too many things, you won't be able to withhold or, kind of get all that information in your brain and start. So I think we're in for a great ride. I think there's a lot more coming, and more than ever now, there are hundreds of newer injectors coming to market, nurses, doctors, PAs. Lots of people want to get out of the hospitals. We're seeing an influx of providers wanting to get out of general medicine and more into aesthetic medicine because they think it's a happier place, and it is a happier place. But not everybody does it well. And not everybody's, I would say that people's motivation for getting into aesthetics is sometimes not right. They think it's going to make them a lot of money. They think it's going to be this glamorous. And to be honest with you, day to day isn't so glamorous. You're there helping patients just like any other medical provider. But at the end of the day, we can make a nice income, but you've got to be passionate about it, or you won't make it in the kind of dog eat dog world that's out there, because you have to get patients that really trust you.
Yeah. Okay. Now, it's interesting because you kind of brought this up before. You're talking about getting into functional medicine, regenerative medicine, which is I'm starting to see in more and more aesthetic practices starting to bring that on. I think this ties into you saying there's a lot more that's been happening and being released. And where do you think, as far as functional medicine and regenerative medicine, what place do you think those types of medicine have when it comes to aesthetics?
Well, I have a real big heart for that because I went through a very stressful time in my life, about 5 years, where I put on about 10 pounds every year. It was COVID. I was in my master's program. My father passed away. So it was kind of this building of let's gain 10 pounds, let's gain 10 pounds, let's gain 10 pounds, and let's not get it off because you're under so much stress. So at the end of that, I was on a journey for my face looks good, looks fuller because I have no wrinkles from being fat. But I really didn't feel so good about myself as a whole as far as confidence goes.
Hmm.
So I knew I had to tackle that, which is a weight loss issue.
Hmm.
But along with weight loss for an older female like myself is there's a potential that as you lose weight, your face starts to show more wrinkles. The
Hmm.
fullness goes away, so you sag. So I knew that the potential as I lose this 50 pounds that I've gained over 5 years or 7 years, that I would sag, need a facelift. I mean, there's a lot of things to weigh and balance for your patients when they go on these journeys. So I started a weight loss program with a dear friend out of the East Coast, and I got the medicine from her. So I started on semaglutide, which is the
Hmm.
generic form of Ozempic, did a small dosing along the way, just trying to see if I could kind of microdose it. Could I
Hmm.
lose weight slowly so that my face didn't sag, so I could keep up with it? Like, how would that go for me on my journey? In the meantime, trying to stay healthy and take the proper nutrients, get those that are really bioavailable. So it was a ton of research over the course of a year in which I lost 50 pounds slowly. And I will tell you that it made a world of difference for me to do that because I'd always been a thinner person my whole life. And so that thicker space for me wasn't super comfortable nor confident.
Hmm.
So with that being said, I got really excited about how could I help some of my patients, because when they started watching my journey, they were like, "What are you doing?
Hmm.
You look like you look so happy." I'm like, "Because I feel happier.
Hmm.
And let me tell you what I'm doing." And so it almost pushed me to bring that into my practice because I have thousands of patients and they wanted whatever I had, they wanted that.
Hmm.
So I did a lot of research for them. I started with two different medicines. We worked with nutrients to help them so that hair loss didn't become an issue, skin sagging didn't become an issue. We had things we could do to help them if we noticed sagging and wrinkles, all the things. And I'm telling you, it's so comprehensive that I feel like it's kind of beauty on the inside and outside. Whatever that patient needs to do and be to feel their best, we can do it for them. And I know there's more to come, which I'm super excited about because I'm on a journey and I want to be able to offer those things for my patients because it helps all of us.
Hmm. That's fantastic. That's an incredible story. I can see why your patients would be interested in having that applied to their own lives as well.
Yeah.
So I have one last question for you, Connie. But before I ask it, I want to point people to your website at www.conniebrennanrn.com. Now, last question is, what is the most important piece of advice you can give to someone who's thinking about getting some type of aesthetic treatment or procedure done, but isn't sure which provider to choose?
Ooh, that's a loaded question. That's loaded. So you're, from the patient standpoint, you're making phone calls, you're looking at Google reviews, you're doing your research, what I think is really, really important. Time served in this industry is a tool to go by, knowing that that provider has experience. Sometimes the experience looks better than it is. And sometimes that provider isn't working full time in their practice. Maybe they're dabbling and they've done a part-time thing for a while they're maintaining their full-time job. There are providers that come into this industry that have worked in the emergency room or like myself in the operating room for 8 years. They'll say, well, I've been a nurse or a nurse practitioner for 25 years. It doesn't necessarily mean that they're a great aesthetic medical provider. So really digging underneath all the labels, like I have a lot of labels behind my name, but they don't mean anything if I haven't treated enough patients and made enough people happy and the outcomes haven't been great. So I would say really do your research. Ask your friends who look amazing who they see, because sometimes that word of mouth referral still today, it was the best thing years and years ago, and it still today trumps almost everything. Whereas you look so good, where do you go and who do you see for your skin? If you ask about skin, sometimes people are more apt to share information. If you say, where do you do your Botox or your fillers? They may not want to share, right? Because some people are still really private. But if you say, where do you go for your skincare? They might give you a lead to where they're seeing those patients that look bad out there, like their lips enter the room first, or they look like a Spock devil because their toxin is done so awful. Those are the patients that you want to maybe ask where they go and then don't go there. So.
Okay, got it. Well, there you have it, Connie sharing her expertise. Now, Connie, where can people contact you?
So I have a couple ways to contact me. My email address is botoxconnie@yahoo.com. That's my personal email address. I'm happy to share it. And if I don't respond to you within 2 or 3 days, don't be mad at me because I'm not on email every day because my hands are in gloves. That's one way. I do have an office number. My Lifetime Clinic is 952-541-7127. That is my Lifetime office. My staff there is great at collecting information. We have a full staff of providers there who are excellent, who I've hand selected and they've been trained there and do a great job. And we can steer you from there. And you can also reach out to my Instagram or follow me, conniebrennan.np. I'm an NP now, you guys. I'm not just an RN. I never said just an RN, but I did work hard for my master's and gain that 50 pounds. So like, I am so excited to have that degree because it's helped so much. So those of you thinking about going into that, do so. It's worth it. So conniebrennan.np on Instagram, and you can DM me and then I can respond to you there too. So there's quite a few ways you can get in touch with me.
Perfect. Great. Well, Connie, thanks for being on the show and sharing your message.
Thank you so much for having me. It was a blessing to be here. And I hope that this reaches those that need to hear it.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.